Let's do a box squat. So a box squat is extremely important in the progression of squatting, because how we're going to use it right now is to give you a place to stop at in order for you to stay really focused on keeping your pelvis and the bottom of your ribs parallel to each other. Okay, because what happens a lot of times in people's squats, and where the dysfunction and the pain comes from, is when you start getting rounding of the spine in the squat pattern. And this is how we're going to take that out before we, and again, then increase the depth of the squat. Okay, and this one is going to be with legs about medium wide with the toes turned out. So this isn't a narrow squat, this is a wide one. And the reason for this is so that we bias the glutes a lot. Getting the butt to be stronger is a huge part of getting our bodies to feel better in general. Why is everyone's butt so weak? This is a question I get asked a lot. I don't know, because we sit on them all the time, maybe. Maybe also because we really don't train them in our lives anymore. But when you have a strong butt, your back doesn't have to do as much, your pelvic floor doesn't have to do as much, and it's a very relieving experience. Okay, so you're going to set up the chair that you're going to start using this with. You're going to set it up so that the corner is pointing to where you want to do the squat from, right? I don't want you sitting on it like this. I want you sitting on the corner, because if you sit on it like this, you can kind of get in your own way, and then you're dropping on your thighs, and it's just a lot more awkward. So make it so that the corner is pointing straight forward. Now start with whatever height you have, or if we've talked about a height together previously, do that. And then as we move through your program, I'll tell you, you need to find a shorter chair, or try to find something a little bit lower, or try to put some stuff up on that chair so you're a little higher, right? So start somewhere and we'll go from there. You're going to step your feet wider than hip width with the toes turned out. And I want your feet to be about even. So make sure that the angle is about the same on both sides, okay? Now, your weight is going to be completely centered on your feet. This is an extremely important thing that we say over and over again. Notice if you're rocked forward or if you're rocked back. And it can be kind of hard to notice, because if you've been there for a long time, it's become your new normal, right? So is there the same amount of weight through the front of your foot as there is through the back of your foot? And how about between your right foot and between your left foot? Okay. Then you're going to gently bring your pelvis into that neutral position, which for many of us is drawing the tailbone down and the pubic bone up. So it's this way with the hips. Now we don't want to go too much, right? We want to be in that balanced position, feeling like there's still a little bit of a lumbar curve, but our waistband is parallel to the ground. Okay. The head is back in line with the body, and then we're going to exhale all of the breath out so that those ribs seat down. Good. Bring your hands in that C-shaped 360-degree breathing position so that your thumbs are in your back and your fingers are around the front. You're in the soft tissue of your belly. And what you're going to do from that all the way exhaled position where your ribs are actually seated down is you're going to take a 360-degree breath, and then I want you to keep that pressure out as you do this, okay? So it's almost like you're going to blow out a candle. It's that feeling of blowing something out where you're stiffening here. So the easiest way to explain it is if you inhale 360 degrees into this whole area. Now I want you to keep that pressure out. So if I were to poke you, it wouldn't just be soft belly, right? It would have some resistance to it because you're keeping it filled up. Now, this is the easiest to do in the beginning on an inhale. It is not always necessary to have an inhale to make this happen. So as we progress in training, we're going to start to separate those two, where you don't always have to be holding your breath to make this happen. But for right now, that is by far the easiest way. And this isn't a bearing down. Like, I don't want you to feel like you're trying to push a poop out. You're bearing down so hard. We're finding that happy balance in the middle of how much can I keep stiffness in this area without raising the blood pressure, without feeling like I'm going to run out of air. Okay? So take a 360-degree breath. Hold that breath. Keep this pressure out with the belly so that no movement happens from here to here. The only movement is going to happen all the way down here in the hip joints. This is a solid plank that isn't moving, okay? And what you're going to do is move right from the hips, letting the torso lean forward so that you can bend at the hips, feeling the butt turn on, checking in with yourself as you come down. Is the weight staying centered on your feet? And then I want you to just tap your butt down barely and then slowly come back up. So the butt touching down, you're not actually dropping any of your weight onto the chair. You're just doing a little tap, like you're trying to not wake up a baby who's sleeping, and then slowly coming back up, okay? But you're not letting your weight relax down onto the chair at all. You are gonna move on a held breath for now, and it's really important to not let any joints from here to here move. It's all happening here so that the butt helps you. I'm going to turn the chair a little bit and show you from the side. So the feet are wide, the toes are turned out. Again, the only movement is coming from this joint all the way down here. I'm going to breathe 360 degrees. I'm going to bend from the hips, butt goes back, lowering down slow. Is my weight centered on my feet? I'm still checking in all the time. Just a light tap with the butt on the chair and then slowly come back up. Okay? I want to show you what a lot of people will do commonly, especially when they come out of the bottom. So you can come down okay, hopefully, but then people will try to use their back to lift themselves up, okay? It's not coming from the back at all. You're gonna keep from here to here exactly the same, and the driver of this movement is your butt. So you're gonna push down into the floor and use your glutes to straighten the whole body back up. But these muscles here that would lift my back up actually aren't engaged. I'm letting the butt do it. So I'll show you one more example. Keeping that pressure out, and as you can see, I'm talking, but I'm still keeping that pressure out in the belly. And that's because I've practiced the difference between breathing and bracing. For now, you're going to keep your breath held, keeping that pressure out as you come down, using the glutes as you come back up. Okay? Enjoy.